Welcome to the Tarrant County Medical Minute podcast.
Hello, my name is Omar Selod. I am the past Tarrant County Medical Society president. Today on our podcast, I'm joined by transitional year interns at Baylor All Saints Scott and White Hospital. So joining me today is Dr. Kobe Miller, Dr. Miguel DiMarzo, Dr. Zach Griffin, Dr. Jake Blaylock, and Dr. Amanda Key. So why don't we start off with, we'll go in order here, starting with Kobe. Tell us where you're from, what's your hometown, where you went to med school. Obviously, we know where you guys are doing your internship, what field you're going into, and where you're going to do your residency.
Yeah, thank you. So I'm Kobe Miller. I grew up here in Texas, grew up in College Station, went to undergrad at Texas A&M University, went out to Glendale, Arizona, did medical school at Midwestern University, and then I'm obviously here at Baylor All Saints doing my transitional year. And then I'll head up to St. Luke's Rehab in Spokane, Washington to do my PM&R residency.
Hey guys, my name is Miguel. I grew up all over, but mostly call Searcy, Arkansas home. Moved to Oklahoma, did undergrad at Southern Nazarene University, did grad school at OU, and then went to med school at Kansas City University in Kansas City, where Dr. Selod also went, and it was named something totally different back then. And then I will be going to Bumsey in Dallas for PM&R.
And I'm Zach Griffin. I grew up in Utah in a little town called Syracuse, which is a little bit north of Salt Lake City. Did undergrad in Utah at Brigham Young University. Then went down to med school in San Antonio at UT Health San Antonio. I'm here for intern year, and then we'll be back there in San Antonio for a radiology residency.
Hey guys, I'm Jake Blaylock. I'm from Springdale, Arkansas. I went to the University of Arkansas for undergrad. Woo pig suey, you know. And then went to TCU for medical school down here in Fort Worth. And after this intern year, I'll be doing anesthesia at Brown up in Rhode Island.
And I'm Amanda, originally from Albuquerque, New Mexico. Did undergrad at TCU, then went to Texas Tech in Lubbock for med school. Came back to Fort Worth for this TY transitional year. And then I'll be headed to Phoenix and do my radiology residency at Creighton.
All right. So we have a slew of anesthesiology, radiology, PM&R. So you guys are doing a transitional year. So Jake, talk to us. There are different types of internships we were discussing before we aired. Transitional year, prelim IM, prelim surgery. Can you explain that? We have some med students that listen. I get asked the question. I don't know the answers as well as you, so explain that for us.
Yeah, absolutely. So there's really 3 different types of intern years. So when you think about it, a lot of programs have all the years at the same place, and those people don't have to do an intern year. But some programs like PM&R, dermatology, radiology, and some anesthesia programs require you to do an intern year somewhere else, and that could be a transitional year, a prelim IM, or a prelim surgery. A transitional year, I like to think about it was like almost like another 4th year of medical school where you rotate through a lot of different specialties, internal medicine, ICU, but you also get a lot of elective time as well. So it's great, except for you actually have responsibilities this time because you're a resident, unlike a 4th year medical student. For other years like prelim surgery, you're basically going to be doing surgery months most of that intern year. So usually a little bit more grueling hours. And then internal medicine prelim, again, is mainly going to be doing internal medicine during that year. So you'll be acting almost as an internal medicine resident for a year.
So you'll do less internal medicine months in a transitional year internship relative to the IM, prelim, or the surgery. Surgery is different, right? I mean, I've heard the surgery year is grueling from a prelim perspective. Is that still the case? I guess it depends what is grueling, right? It depends on you, right? But, I mean, I've heard that's relatively tough.
Yeah, places I interviewed, their surgery hour-wise were pushing close to 80 hours a week work-wise, which is not where we are. I think for TY, we average 50s hours a week.
Yeah.
Depends on the rotation.
Depends on the rotation a lot, but it's a lot better lifestyle-wise.
Okay. And so, and another question I get from a lot of medical students, especially the first and second years. So you guys are doing a transitional year. An advanced program means you're starting your second year of residency. Can somebody discuss on that? What's the difference between advanced and categorical programs?
Sure, I think I can touch on this. So kind of like Jake was saying, it was anesthesia or PM&R and all the fields we're going into. So categorical is basically where all 4 years or however many years your program is at one location. Advanced is where you match into the specialty starting as a PGY2, but you still have to have that intern year, whether that be TY or the prelim options like Jake was saying. Some programs actually have it where they partner with another institution. So similar to BUMC, like I'm doing, they partnered with All Saints, where we had the option of opting into the TY year if we matched at the advanced program. So there's a lot of variations, but that's the most simplified way I would describe it.
Yeah, and I would say the biggest misconception with the transitional year, when people hear that, is they assume you're almost taking a gap year. But it's not a gap year. It counts as your year of residency. So even though I'm doing anesthesia, which most programs are categorical, 4 years at the same place, since I'm doing my transitional year here, this counts as my PGY 1 year. So I'll do 3 years of anesthesia when I go to Brown. So still just 4 years total.
Yeah. So, and then for you, because you're doing anesthesia, you have to do more ICU months than them?
I do, yeah. So I did take some elective months and use ICU for elective months. So a little bit more grueling schedule, but, sometimes your advanced programs decide kind of what you get to take your first year.
You could have done PM&R.
I did do PM&R. As an elective, not as a specialty, though.
Okay. Fair enough. Okay. So when y'all were applying, this was just, a year ago, right? You're actually in the application process. It's been less than a year since you matched. What were y'all looking for in an internship? Is there anything specific?
Yeah, I was looking for a large proportion of the months to be elective months. I think that just gives you a better overall kind of view of the rest of the world, especially in radiology. You see every single specialty. So as much as I could see from kind of the other side of the screen, I was excited about. And typically better work-life balance as well. And then good training when you were in those kind of harder months of floor, ICU nights, things like that. So it wasn't just a complete blow-off year. I still wanted to learn, wanted to be prepared for my advanced program afterwards, but also get to see as much else as I could. And then location was the other thing, kind of being in a central place. A lot of us have family or connections in the area, being close to a big airport, lots of direct flights, very accessible.
Yeah. No, your program is solid because, I work with y'all in the program, and I do feel like your medicine months, like you say, are very challenging. You learn a lot, you get ICU, but you do have electives, to your point, right? If you're going to go into radiology, you want to be able to work with all the specialties and see that. If you want to do anesthesiology, PM&R, whatnot, you want to be able to go to other fields as much as you can to get a little flavor of it before you start your residency. The more well-rounded you are, the better prepared you are. Anything?
That was one thing that, talking to residents, radiology residents, they always said, hey, after about 3 months of medicine, I got it. I had learned what I needed to learn from that. And so for me, that was another big plus of a transitional year program. I could go do emergency for a month. I could do surgery if I want. I could do all these different rotations and get different perspectives. And I think that's really valuable.
Yeah, I think when I was going through and thinking about programs, I think I applied to a bunch of TY and preliminary medicine programs, and I think I would have been happy doing either one of them. One extra month of inpatient medicine versus one elective in the grand scheme of things wouldn't be that different of a year. I think the thing I focused on was, do the residents there seem happy? Do the faculty seem like they, are a good faculty and they care about you and everything? So I think I was more focused on that, which kind of brought me to Baylor more so than exactly which rotations or what's the structure, because after the end of the day it is 1 year, but the people you're working with I think are really important.
Yeah. All right, so you guys become doctors in May. You graduate, now you're doctors. Starting July 1, you're on the floor. There's no more, I'm a med student, I can ask my resident what to do. What's the stress like? I remember what it was like for me, and it was terrifying my first night on call, the first time I get a call for, hey, Dr. Selod, come to the floor in room 333. Somebody's got chest pain, they're short of breath. Talk about that anxiety, what it's like for y'all.
feel like I can talk about this a little bit. So 3 of us actually started on ICU, so that was a little bit intimidating, like when you're transitioning and first coming into it. Because like you were saying, you're flipping that switch where you had a safety net, and now the safety net, it's still in place, but you are actually making decisions and putting in orders that are going to occur before maybe they get checked right away. So you do have to make decisions on the spot. I remember my first day, actually, as soon as I walked in, I was told like which patients I would have, and one of them was actually actively not stable. And I had nurses coming up to me and asking like, "What do you want to do, doc? Like, what do you want to do, doc?" And that was like pretty intimidating. At first, I was like, "Well, where's the doc?" I didn't think, I was still trying to find that mindset. But once you kind of get over the nerves and just go and see the patient, a lot of the things that you learned in med school surprisingly just came back pretty quickly. And after I made like my first order and did a couple decisions, I felt more comfortable. And I always try to stay on top of like reading at least one thing every night. So that's something I learned from doing sub-Is and such, that just reviewing one small topic, whether that's about a patient or something that you're going to see eventually, was a good refresher. And I don't know, at least like, how was it for y'all? That was the case for me anyway.
Yeah, I would love to hear about Amanda's experience because we're coming together for the first time in ICU, right? And she's very quiet, very reserved when you first meet her. And the first day she was on call, I believe, right? Yes. So our upper level resident left at 5 p.m. I left, and she was the only one there day 1 in the ICU.
So very first day of being a doctor, I was on call by myself for 2 hours. So in charge of the entire ICU for 2 hours. And the attending looked at me and said, "Just keep them alive till 7:05. And then it's someone else's problem." So even just like walking into that first room and introducing yourself, I had to catch myself, instead of saying, "Hi, I'm Amanda," into now I've metamorphed into Dr. Key, and there's not some huge thing that happens overnight. You just slowly become a little bit more confident, but it's a big adjustment for sure.
Yeah, I think my first month was just on wards, on inpatient medicine. I think one of the biggest transitions is, writing the notes is different now that you're an intern. Putting in orders is different. Your communication with nurses and other people in the hospital is just a little bit different. But I think one of the big things, especially here, people understand that, your first few months you're getting the hang of things. You don't know how things work necessarily. So just making sure you're leaning on your upper levels and asking questions and verifying stuff before you just put stuff in or, make some mistake here or there. Just asking the question, because people want you to succeed. You just kind of have to ask for the help.
I remember for me, it was a different era, right? We couldn't text communicate with nurses or whatnot. You just get a phone call, you're in the call room, you have to go to the floor. I remember I tried to buy time to what you said. I would say ask the nurse, and they know a lot. Mm-hmm. They're in the ICU nurses. They know a lot. All the nurses know a lot, but they know what to do. So I'd say, "Hey, Dr. Selod, what do you want to do?" And I'd say, "Well, what do you think I should do?" Like try to buy some time, give me some answers. Well, I think we should do this. Yeah, I think that's a great idea. And I would kind of, ask questions a lot. Now we had a book back in my day. It was called On Call. So when I was walking from the resident room to the patient room, let's say somebody had a seizure, I would open the book and I would read, and it would say, "Okay, be calm. Here's the labs you want to do. Here's what you want to do." So I had that resource. I don't see residents around with books in their jackets like we had back in the day. What resources do you guys use nowadays? What would you tell a fourth-year med student that's about to graduate, going to start their internship soon? Is there anything you would recommend?
Yeah, I think Up to Date is probably the most used program. We even have it in our Epic system. You just click on it, pulls up to Date, which is a link to a website. Some medical students use it as well, but especially residents. It's not necessarily the best, more in-depth for studying, but for quick information, different things to look at. Yeah, I think it's the most people go to.
Yeah. Okay.
There's a newer one app called Open Evidence that's AI based, and it searches all of PubMed. And
wow.
you can just, it's nice because you can kind of phrase it how you want to, like come up with a differential for hypokalemia, and it will spit out a pretty decent differential. So it's good for just kind of priming your system before going into a room.
Yeah, to kind of tag along that, because I've been using Open Evidence a lot more lately because I didn't discover it till recently. I also like that you can click the article that it's referring to if you're asking a specific question, or if an attending's like, I've had an attending ask me, like, what's a topical or what's a treatment, like oral or topical for whatever condition. And maybe there's not like a straightforward answer according to like guidelines, but then I was able to see articles from Open Evidence, so I could see like how much evidence there was, and like it made me sound a lot smarter than I probably am. So it was very helpful. I really like that resource.
What are some calls that you all dread? For me, it was seizures for whatever reason. I hated to be an intern on call in the call room and they call me and patients having seizures. What are some of the diagnoses you're like, oh no, don't call me on this? Gives me anxiety.
Yeah, I don't know about you guys, but for me, it's definitely like different cardiac arrhythmias, because I feel like that was a very urgent matter that needed to be dealt with right away. Other matters, sometimes you can ask your up-level resident or an attending, but if they're not to be seen on the floor and someone goes into VTAC and is unstable, that's definitely the most nerve-wracking.
Yeah, I think for me, a lot of the times it was when they were having some type of focal deficit or some change, or complaining of vision changes or something, and you were worried, oh man, like is there some type of stroke going on here, something that's really urgent that you have to kind of activate something, and you don't want to be the person that activates something too soon on a false alarm, but you also don't want to wait too long on something serious. So I think it's just kind of anything that makes you kind of make that split-second decision that activates a whole team. Those ones that are a little anxiety-inducing.
Yeah.
Yeah, I feel like kind of going off what you guys were saying, the word posturing gets used a lot, and it can mean very different things depending on who's saying it. So that's one of the ones I always dreaded a lot, because I never knew if it was very concerning or if maybe they were just misinterpreting what posturing actually is. So those were some of the ones I dreaded a lot too, just because it was either like there was no middle ground. It was either it's a really bad situation or I didn't necessarily need to get like messaged about this or something like that.
So I was hanging out with some of my PM&R residents, and they were kind of complaining about sometimes getting called for silly things that they don't feel that their pager needs to go off for, and it's like, why are you calling me for this? Do you guys have that happen to you? Are you guys willing to say it, admit it?
We had a stretch for a few weeks where we'd get alerted for changes in the MCVs on the daily CBCs. So like, the MCV went from 90 to 85 or something. We're like, okay. Thank you for the update. But yeah, that was a stretch for about 3 weeks where we were getting those notifications every morning at 6 a.m.
Oh my gosh. Do you have interns or some of you them that the white cloud hangs over and the black cloud's always over? We used to have that. It's guys or girls in our intern class that it's like this one. Oh my gosh! If you're on call with this person, it's going to be a rough night. Do you guys?
I mean, I think for some of us, it might be too early to tell exactly. We've been on a few inpatient rotations at this point, but I know that there's a bunch of like the third-year internal medicine residents who are well established as either a white cloud or a black cloud.
Yeah.
And you'll hear them talking about it, and then you'll be like, I was on the ICU with one, and then you kind of experience it, like, something's gonna go on with her,
There's nothing better than a senior resident that teaches you. Mm-hmm. And you guys are going to be residents here soon, and just remember that. There's nothing better than somebody who actually takes their time and understands that, hey, I have a junior resident under me, and to take them under my wings and teach them. And there's nothing worse than the resident who just dumps on the junior.
Right.
Frustrates me. I know y'all can't say much, so we'll leave it at that. Okay. So what advice do you have for fourth-year medical students that just graduated and they're about to start their internship? Go vacation? Should I read something? For those 2 months you have May, June off, and then you start in July. What would you do now in hindsight?
I would definitely say go vacation, enjoy your time. No matter how much you study over that 2 months, you're still going to feel like you don't know anything when you first start, and you'll catch on just by experience. So no need to waste your last summer break that you'll probably ever have studying. Yeah, don't do that.
Okay.
I am of the notion, same as Jake. I think you should enjoy that time. But I don't think it's a bad idea to read a little bit. I mean, like one thing a day for a week, just 20 minutes a day. I think if more than like actually gaining knowledge, it's more about gaining confidence.
Right.
Yeah.
Yeah, I was kind of the same. So definitely agree with like go on a trip, go on like have all the fun. I played a ton of disc golf during that time, but I did like take maybe an hour a day. That's probably more than I actually did. Maybe like an hour every other day. Just brush up on like basic concepts. Especially knowing I was going to ICU, I went over all the ACLS like pathways and stuff like that the week leading up to it. But I would not stress during that time for sure, because that is like the last true free time you'll ever have without having to request time off or whatever the case may be.
Yeah, with that many weeks,
Yeah.
piled on
Right.
each other, that's not happening again in a life.
Yeah.
Well, the thing
And
is
it's
with when you finish medical school, you've taken all your boards, you're ready to start intern year. What you need to know to begin that process. And a lot of the learning that occurs in the first few months is just getting oriented with the hospital, with the EMR, and just how to act as an intern and a doctor. So, and that's not something you can read in a book. That's something you have to do through the time and through the experience. So, I mean, you're ready to do it, but it's just gonna take some real world experience.
Yeah, it's hard to even know what to study during that time frame because you could study anything. Maybe you're starting with an elective and you can narrow down your scope of what you would read up on beforehand. But yeah, ICU, it was ACLS and maybe a page on CHF and DKA, some things that you would expect to see routinely, but you will always see unexpected stuff too.
So one thing, I deal with a lot of med students, as you guys know, and I get asked a lot of times, after they've matched, what rotation could I do to prepare for internship? Is there something when you look back on, it's like you're glad you did a cardiology rotation or critical care, not that important, you learn on the fly? Any suggestions for students?
I think it depends maybe on what you're going into and what your intern year is. Starting on the ICU, anesthesia was really helpful for me. I did 4 months.
Of course.
So yeah, I felt really comfortable with managing airways, like pressor medications, paralytics, things like that you see a lot in the ICU. I think that made my experience much more comfortable and less nerve-wracking.
Actually, that makes sense.
Yeah.
I never thought about it like that.
Mm-hmm.
Yeah.
Yeah, we see a lot of cardiac stuff as well. I did cardiology rotation. So yeah, pretty much most of your ICU stuff is intubations, pressors, paralytics, sedation, which overlaps a lot with anesthesia.
Okay.
One of the more useful rotations I did in med school was infectious disease. I think it's really a good idea just to have a working knowledge of some of the basic antibiotics because you as the primary team are often the ones starting antibiotics, and my attending physician just had us memorize a list of everything that covered MRSA, Pseudomonas, and anaerobes. And so just having that working knowledge is a great place to bounce off of.
Never thought of that. That's interesting. That makes sense. What about you all?
I kind of had fun. So I chose rotations that I didn't think I would either have the opportunity to do or got me a lot more procedures. So I did this like modified ICU emergency medicine rotation where I hung out with the resident that was on ICU and was responsible for doing all the central lines, ART lines, like all the procedures that needed to be done. So I got to assist with a lot of those and actually do a few on my own. Well, not on my own, but like with supervision. And that gave me a lot more confidence being in the ICU and having to do it on my own, and having to know how to use the ultrasound and how to position my hands and things like that. And it wasn't Super stressful as a med student because they don't expect you to know how to do these procedures, and they kind of walk you through everything. So by the time I got into residency, it was a lot more natural for me to do some of those procedures.
So you guys are in the middle of your training, right? Like you did 4 years of med school, you have, a couple years of residency left, you're in your internship, you're right in the middle. I remember there are times I'd get frustrated because my buddies have graduated college, they've got jobs, they've got more money than I do. You're not getting paid a lot as an intern relative to the work you're doing with the, how serious a job you have. Do you guys ever get frustrated? I used to. It never slowed me down or bothered me enough, but sometimes I'd be like, golly, I'm only halfway there. Do you guys ever find yourself thinking that?
Yeah, absolutely. I felt that way quite a bit. I think one of the biggest things that I've struggled with, or that I find myself coming back to, is just wanting to be in my career, be in the place I'm going to be, have some. One of the big things about medical school and residency is every month's a new month, and you're doing a new thing, you're working with a new team, it's hard to get really comfortable and kind of get in a really good rhythm, because that rhythm changes after 4 weeks. So I think I find myself sometimes really wanting to just arrive at my destination, for lack of a better term.
Yeah.
Yeah, I feel like we all have to give up sacrifice to be in residency. There's a lot of major events that we won't be able to attend to, or whether it's a friend's vacation or whatever it is. I know during nights, my sister's actually pregnant with her first baby, and she's doing a gender reveal. And we were doing admissions, and one of the patients in the ED was just not very stable. The nurse really having problems with them, so I had to miss the gender reveal. I was going to join it on FaceTime, but I had to miss it. So I feel like there's these major events that you really miss.
Yeah, your friend can be getting married and you're on a rotation, you cannot take off.
Mm-hmm.
You get one day off the week, or you just can't plan sometimes these life events, and it gets frustrating. But it pays, you chose this, and it is what it is, but it is tough. It is tough at times. So what do y'all do do you have time for wellness? What do you do for wellness, stress relief and all that? Intern year's hard.
Mm-hmm. I hang out with my family, my wife, and I like to get on and run on the trails down by the river. Yeah. I enjoy that, just exercise. I feel like it's a good way to just...
Fort Worth's so great with that.
It's perfect.
We've got trails, the weather's great down here.
Yeah.
Outdoor activities all the time,
I think you just got to take advantage of the nice days. Especially when we started, it was July, so it's 105 degrees every day, so it's hard to get outside and do stuff. But now that the weather's gotten nice, I think when there's a nice sunny day and you have a day off, or you get off a little bit early, you just got to take advantage of it. And if that's running by the river, or just going to a park, or doing whatever you like to do outside, just make sure you take advantage of the time you have.
Yeah, I think everyone has different hobbies, so you just have to make sure you make time to continue those hobbies in residency, because it'll never be a good time to keep doing them. So you really have to schedule it out almost. I prefer more extreme hobbies, but whatever your hobby is, just keep doing it.
Yeah, your extreme hobby is jumping out of an airplane?
Yeah, so I'm a licensed skydiver. I have over 500 jumps. So yeah, that's what I do.
Our first weekend in ICU, a nurse came up to us and asked what we were doing with our day off. And I was like, doing laundry, maybe going to the grocery store, catching up. And Jake goes, yeah, I'm going to go skydive. I need to get more interesting hobbies.
Sounds like Jake. Okay. All right, so we're you guys came today to our Medical Society monthly meeting. And, part of my involvement with the Medical Society has really been to try to get medical students, interns, residents involved, because I feel like I didn't have that exposure when I was, younger in my training. And when you come to the meeting, you see all these physicians really fighting for us and fighting for our patients. So what was your take on today's meeting? How did you feel about it,
That was my first experience or encounter with organized medicine. So it was really, I often view policies as just a bystander, and they're affecting me, but thinking about actually becoming a cog in the wheel and making that impact was very cool.
Yeah.
I think I didn't realize whenever people talk about changes that have been made or things that have been implemented, you don't realize how much work goes into it and how many different people it takes to finally get something through or get something changed. So I think it's really cool to see just the whole thing in process.
Yeah, I think what's important to see is a lot of the politicians and bills that kind of go through is not necessarily based off of medicine and evidence. A lot of it is going out there and talking about your profession and the things that need to get done. And if they don't hear that from you, then they just go off their idea, but they're not healthcare workers. So really going out there and advocating for yourself, your profession, and your patients, because otherwise they're going to hear it from other groups that may not have your patients at the forefront.
They don't. I mean, medicine is a business for many. For us, obviously it's a business, but we're also doing it to take care of people, and that's what's hard, right? Like in med school, you don't have time to think about it. You hear about it, but you're so into your books, you're so into your rotations. You're worried about where am I going to match. You just don't have time for all this stuff. Then you get into internship, and you're on nights. You don't even see the world for a whole month. You're just sleeping during the day and awake at night. But I mean, the part of the problem I feel like that we have as a profession is that we don't take enough time to get involved locally. And I mean, I look at myself first and foremost with that. But as I've gotten more involved, I've seen it, and that's why I kind of wanted to bring you guys. That's why I love having you guys up at the meeting today, and you guys have been sending representatives every month just to learn about it. And, it just takes a few that can make a big difference, so.
Yeah, I think there's also a difference in power. So, I felt like as a med student, I didn't have any power to, really make a difference.
But you actually.
But you do, yeah. You don't realize it.
Yeah, we were sitting in a meeting, and they were talking about how, they have first Tuesday's legislative session is coming up in Austin, and if when med students show up, that actually means quite a bit. You guys are paying to be trained right now, and I do feel like that with y'all's generation. I do see a lot more advocacy. I think social media actually helps people see about issues on their phone, or on the computer. People are more aware. Maybe in my year that wasn't the case as much. I mean, if I had to find out something was from a newspaper, I'd have a newspaper or watch the news. You're never at home at time to watch the news. If you didn't get it, you didn't get it. Now you can get news all the time, and so I do feel like you guys are better equipped to tackle the issues. I do see a lot more passion and all that. So
I think one thing too is going from medical school to residency is you learn so much more about the processes of every part of medicine, and I mean where it goes from practice settings to billing to legislation, and I mean I've learned so much in the past 6 months that I didn't know even existed when I was a medical student, and so one of the things that the meetings have taught me is just all the different issues that are out there and all the different things that practicing physicians who have been out for 30 years are dealing with that I didn't even know was an issue.
Well, one thing I'd say for you, Kobe, that I've seen is, you're in clinic and you're constantly, and Jake as well spent time, and Miguel, you guys are always asking questions, like why, and talking things through. And I'm noticing that more and more happening, and that's great to see, not just, what nerve innervates this muscle, and that's it, we're done for the day. You guys sit a little bit longer, and we talk about the business side of medicine, the politics of medicine, and all that. So that's good to see.
Yeah. So in med school, I was involved in the student section of AMA. So it felt like it was its own little world, and that you were only participating at the national level. And something I thought was really cool about seeing the meeting today was that you kind of saw the county level individuals talking with the state level, talking with the national level folks. So it was really cool to see everybody in one room. So it felt like you were actually being more transparent with one another versus in med school. It kind of felt like, okay, the student section at the national level is its own little bubble, and then the state level was its own little bubble, but they never really worked together or had meetings together. So it was really cool to see today that everybody was constantly communicating and updating each other on what the latest news is, and how that influences like each level.
And some of them are at points in their career where it's not really going to impact them. They're fighting for you all in the future of our field. So it's cool to see. I mean, I've gotten to see it firsthand the past year, and so it was nice for y'all to come up and see it. So, all right, I do think you guys have to get back to clinic and go to work. You are interns,
Unfortunately.
So I think that'll be the end of our episode today. If you can please subscribe to our channels on YouTube, on Spotify, on Apple Podcast, on X, on Instagram, on Facebook. We're all over the place. So that's it for this episode. Thanks for tuning in.